This is Wellspring, presented by Spectrum Health-Zeeland Community Hospital on 99.7 and 1450 WHTC.
And for this Thursday, February 3rd, we welcome in Wellspring, Sara Donkersloot. Good morning, Sara.
Good morning, Gary, and welcome to Wellspring, a weekly radio show sponsored by Spectrum Health-Zeeland Community Hospital. When you're coping with new or ongoing pain, relief looks and feels different for everyone. And I am just really delighted this morning to have Dr. Ryan Hodges, a physical medicine and rehabilitation physician from the Spectrum Medical Group. He's here to discuss how Spectrum Health Spine and Pain Management Team has expanded to the Lakeshore to provide personalized care and treatment for each person's unique health journey. Good morning, Dr. Hodges.
Good morning. Thank you for the introduction.
Well, it's just a delight to have you. So tell us a little bit about yourself and your role with Spectrum Health.
Yeah, so I'm a physical medicine and rehabilitation doctor, also known as PM&R or physiatry. And my role here is to help provide pain relief for patients out here on the Lakeshore community. We're extending our services that have already been present in Grand Rapids out locally here in Zeeland and Grand Haven areas.
So Dr. Hodges, when you're in medical school, there's a whole spectrum of, where you can specialize in. Why did you choose to specialize in this?
Yeah, so that's a good question. I was attracted to PM&R because it blends aspects of neurology and musculoskeletal medicine to improve people's function and quality of life. It integrates exciting technologies, devices, and imaging guidance to help achieve our clinical goals. And it was something that I just really fell in love with during medical school.
Well, we're glad that you did. So what do you enjoy about this type of work?
Of course, the people that I work with have been really great. We've been started up here since January, but I get a lot of personal satisfaction when somebody walks out of our clinic better than they walk in.
Yeah, I can understand that because, when people are, dealing with pain, I'm certain they come in and they say, how can you help? And when, like you say, when there's a smile on their face when they leave, wow, that's just got to be just personal satisfaction. So, okay, so we're talking about physical medicine and rehabilitation clinician, and we'll say PM&R because it's quite a mouthful to say. So what is your role?
So the role of a PM&R doctor is pretty broad, and people specialize into different things from everything from sports medicine to stroke recovery or spine care. I subspecialize into pain management and that spine care, but I do a lot of musculoskeletal medicine as well. But the common goal that unites all of the doctors within PM&R is that we are trying to get people moving and functioning better. We want to address difficulties that people are having in their day-to-day life, whether that's pain that limits people from moving about their homes or going to work or doing the things that they enjoy, getting back out on the golf course or tennis courts or whatever it might be.
So you mentioned earlier that the services have recently expanded to the Lakeshore. So where are clinics located?
So I am seeing patients in two locations, both here in the Grand Haven Center near Meyer and on the third floor of the Zeeland Community Hospital as well. Now, Dr. Gouge is expanding his services in the Holland and Zeeland areas also.
Okay, so, you talk about, there's a whole spectrum of, why people would come to you. So talk a little bit more about, someone who might be listening out there and they're saying, I have, pain, Dr. Hodges. What types of patients would benefit from your services?
I see patients with new or worsening spine or musculoskeletal pain. Our goal is to provide a multimodal approach using a combination of therapies, medications, injections, and procedures. So if you have been dealing with pain for a long time, that would be a good opportunity to come see us. Or if you're having new sciatica sort of symptoms, those are all also good opportunities for us.
Okay, I'm going to you say sciatic, so what is sciatic pain? Explain that for somebody who might be out there thinking, do I have that, or do I have it, or don't I have it?
So sciatica is the common term for what we consider radiculopathy. So a pinched nerve at the spine as it leaves the spine, and that can cause a host of symptoms from pain to numbness and weakness, with the weakness being kind of more severe. But we also cover a lot of other chronic pain, which is pain that's been going on for more than 3 months, and there can be many reasons for that chronic pain. Arthritis, nerve damage, sciatica, or other neurologic conditions.
Okay, so Dr. Hodges, so somebody's listening out there and they're saying, boy, I've had pain for more than 3 months, and, I may have some sciatic. So can you tell us what's going to happen if they come into your office for an appointment? Just kind of walk us through what a visit might look like.
Well, I spend quite a bit of time talking with patients to help narrow down and really find an appropriate diagnosis. I review imaging with patients who have already had that, or order it if we need it. And I also perform diagnostic tests, which might be a separate appointment, or injections, which would typically also be a separate appointment. But we spend a lot of time also doing physical examination maneuvers to see if we can really narrow things down.
We have as our guest today, Dr. Ryan Hodges. He's a physical medicine and rehabilitation physician from the Spectrum Health Medical Group. And because we are on Zoom, we are not taking any listener questions. But Gary, if there are any listener questions, you can relay them. So thanks for your help in that area.
By the way, I have a question, if I can step in for Dr. Hodges. One question as a patient. Just a general patient. When you come in and you're in this discomfort, there's a question always about gauge the level of pain you're in from 1 to 10. That to me is very tough to do because, and I'm going to be frank with you, Ryan, is the fact that some people have low thresholds of pain, others have high thresholds of pain. To a certain extent, maybe in your role, doctor, you almost have to play detective. Like, well, they may have only a 3 or 4, and actually the problem is even farther worse, and they're just trying to gut it out.
Yeah, you're exactly right. Everybody's pain scale is different, and everybody experiences that pain differently. And so I try to ask those questions because the scale can be helpful for assessing pain over time within one person. So our goal is to get somebody's 8 down to a 3 or a 4, or somebody's 4 down to a 2. We're really looking to hopefully provide services that can reduce pain. And for a lot of these procedures, we're looking for 50% or better pain improvement.
You mentioned that you do some diagnostic tests, and I would imagine diagnostic tests can show too if there's something, physically along with somebody saying, that my pain is a 5 or 6, correct? That's like you said, Gary's saying you're playing detective, but you're putting all those things together to figure out what's going on.
That's correct. I do provide electromyography, which is EMG. It's a test that studies the nerves and can decide whether we're having nerve damage. I also do a lot of imaging review, whether that's X-rays or MRIs, that can show us a lot about the soft tissues, things like discs and nerves as they exit the spinal canal.
So, okay, Dr. Hodge, what is spine management and how do you work with that service line?
Yeah, so our spine management service is a multi-specialty management line. So a lot of times after seeing a primary care physician, I would be the next physician that they would see as a PM&R doctor. And if things are looking like they might be severe, or we find a problem that looks like it needs surgery, then we escalate those services to an appropriate neurosurgeon like Dr. Gouge or other spine surgeon, which we have out in the Grand Rapids area as well.
So, Dr. Hodge, why should someone come to you first before going to see a surgeon?
There are a number of more conservative strategies that can often be helpful and reduce the need for surgery. Additionally, I can offer injections and minimally invasive procedures for back pain that can be helpful for months at a time for people.
So, Gary, I see that we have a listener question.
Yeah, a listener called, and Dr. Hodges, you work and clarify this for me as well, Sara. The operations at Zeeland, the Spectrum Health-Zeeland Community Hospital up in Grand Haven as well. There's no other pain, quote unquote, pain clinics you are involved with, or involving with Spectrum at all on that? Because somebody was wondering if you work at a pain clinic. So is that similar to what you do right now?
Those are pretty similar. I am at just these two locations. I had been in Grand Rapids initially when we started for a couple of months, but am out here full time now, 2 days in Grand Haven, 3 days in Grand Haven, 2 days down in Zeeland. But a lot of what we offer is similar to a pain clinic as well, but sometimes we have slightly different approaches.
One other thing too, Sara, and this is a question more for me than anything else, and you were talking about spine management, Sara, but also pain management. Some patients might go into you, Dr. Hodges, and say, what can you give me to alleviate the pain? I want to get this pain out of the way. And it's so easy to say, okay, I'll write your prescription and away you go. But really, that, I'm sorry, that just covers the symptom. It doesn't deal with the exact problem. And let's put it this way, no pill will be able to pop that pain situation. It's a long-term thing, isn't it?
It is. And the medications are, as you say, they do help address the symptoms, but they're not necessarily addressing the cause. And so a lot of our active modalities, things like physical therapy and exercise and lifestyle modifications, can often be more valuable in a long-term management strategy. But we also employ those other injections or minimally invasive procedures, which can provide long-term strategies as well.
Well, and Dr. Hodges, you mentioned that, there's the partnership with Dr. Gouge, and, that's, a wonderful aspect because, you can, do the initial, but, if probably I'm going to let you respond to this because you're the expert is, if need be, the referral can go to Dr. Gouge to say, listen, we need to try something more extensive. Am I saying that correctly?
That's correct. If we try these more conservative strategies and they're just not giving people the relief that they want or need, then the next step is to talk with the surgeon.
Yeah. Okay. So my guest is Dr. Ryan Hodges. He's a physical medicine and rehabilitation physician from the Spectrum Medical Group. He is at Zeeland 2 days a week seeing patients, and he's at the Grand Haven Center 3 days a week. We have about a minute and a half before you go off. Can you again tell us what type of procedures and services that you provide patients with, and then how does someone get an appointment with you?
Yeah, so I provide diagnostics like electromyography, and then as far as procedures go, I provide ultrasound-guided musculoskeletal injections, so things like joint or muscle injections. And then I also provide X-ray guided or fluoroscopically guided spine injections. Those are things like steroid injection, but also can be radiofrequency ablation or neuromodulation. We are trying to expand spinal cord stimulation services here, and Dr. Gouge is a partner with that as well. And as far as coming in to see me, you can get a referral from your primary care provider if you'd like, or you can call our office.
And your office number is, do you have that offhand? Or we should just say, go to spectrumhealth.org and they can Google Dr. Hodges, correct? Yes.
Yep. I think that's probably the best strategy. You'll talk with some schedulers and they might be different depending on our locations.
Okay. Thank you. And I think the message that we want to provide today is you don't have to live with pain because we have Dr. Hodges and Dr. Gouge here to take care of you. Until next week, Spectrum Health Zeeland Community Hospital wishes you well.